professor at he has been a professor at UW Oshkosh, UW Green Bay, has been employed with Aurora Healthcare, and maintained a private practice for many years. Currently, he works with the Green Bay area public schools. Much of his professional work has involved supporting patients and families who have been challenged by various neurologic and psychiatric disorders. So I'd like to welcome Tom, and you can take it from here.
Thank you. As I start, I just want to make sure everybody can see and hear me. Deb, can you give me like maybe a thumbs up or a nod? Everything's good?
Good, good.
Great. With this technology these days, you have to be careful, right? So I really appreciated Dr. Dent's comments, especially toward the end about stress and coping and ways to cope with stress. Much of what we'll talk about in the next hour is really kind of a follow-up or continuation of the comments that she was starting to make. As Deb and I first talked about this, she asked me to sort of focus this on the question of self-care for the caretaker. And I think that as we get into some of these pieces, certainly the comments and the ideas will fit caretakers as well as individuals who have HD, and really probably most of us. There's a lot of information available about stress, coping with stress, stress reduction, self-care. We could easily devote an entire weekend to this topic. So what I'd like to do in the limited time that we have today is just pick out a few pieces, important pieces that focus on self-care. And I hope that this will be helpful to you in your lives. Self-care is really a very simple concept. It means that we are taking steps, making conscious decisions, intentional actions, things we choose to do to take care of ourselves, to promote our healthy functioning, our healthy physical functioning, and our healthy emotional functioning. It is true that human beings are different in many ways. One simple example is that among our group today, we may have a couple of extreme extroverts, and we may have a couple of extreme introverts, and the rest of us are probably somewhere in the middle. So it makes sense that no self-care strategies will be well suited for everyone, and we want to talk about a variety of options and approaches. And yet we're also human beings, and we share many similarities. I like to think of human beings as organic. We're alive, we're breathing, we're eating, we're sleeping, we're growing, we're changing. Perhaps we can think of ourselves by an analogy, think of ourselves like a plant. Each of us is a unique plant. As I think about the group that's come together today, perhaps we have tomato plants and corn plants, rice paddies, cactus trees, and apple trees. And we can also think of ourselves as the primary gardener of the plant that is me. So in a very simplistic way, we could begin by saying or asking the question to ourselves, what type of plant am I? What are the conditions that I need, that you need to survive in your life, in your circumstances? Are you a tomato plant that needs sunshine and water, but not too much water? Are you a rice paddy that needs a lot of water and sunshine? Or perhaps a cactus tree that really needs high temperature and low moisture to survive? What type of plant are you? What are the conditions you need to survive in your current circumstances? If you don't know how to answer that question, perhaps we can begin by just reflecting on your own life experience. Think of the times, the phases in your life when you were doing pretty well. Not perfect, perhaps, but getting on with life reasonably well. What were the circumstances? What were the conditions that helped you survive and cope well in your situation? There are some common threads, some common things that most of us as human beings should pay attention to and need to attend to. So I'd like to go over a list of a few of those briefly. First, we'll talk about sleep. How much sleep do you ordinarily need to feel rested and to function well? The research tells us that some people need 7 hours, some might need 9 or 10 hours. When we are stressed, we tend to need a bit more sleep, although we may not sleep quite as well. So what's the optimum situation for you? And we also know that people with Huntington's have various difficulties with their sleep. So attending to this in the context of the HD experience is also important. Secondly, we can think about nutrition. What's healthy for you? How many calories do you need to stay healthy, and what do you need to eat? Nutritious foods obviously help us with our energy level and also with stress management, whereas junk foods, perhaps not so much. Again, what kind of plant are you? What's the right balance for you? And again, we know that as HD progresses and a person has more physical movements, they may require more calories to maintain their body weight because of increased motor and muscle activity. So that's a variable that might be considered. And we think about fluids. Most of us generally need 10, 15 cups per day to function well. Too little fluid can cause dehydration, and really a host of problems can come from dehydration, including fatigue and mental confusion. Water's best for most of us. And as we know, as the HD experience progresses, excuse me, people do have an increased risk of dehydration for various reasons. And fourth, what about activity level? Regular physical activity and exercise are beneficial for everyone. Maintaining a healthy heart and good muscle tone are important. Research suggests that regular physical activity are also helpful for our mood. A habit of regular activity can be a benefit to persons experiencing HD. It can help maintain muscle tone and range of motion, balance, and walking and other kinds of simple exercises are very helpful. And it's good to keep in mind that if balance problems have been developing, or if a person's had some experience with falls, it's good to seek out guidance from a physical therapist or from your doctor in terms of healthy exercise activities. Fifth, laughter is good for the soul. Research suggests that laughter helps improve our mood and reduces stress-related hormones. So it's a good idea to spend time each day laughing. It certainly would be reasonable to take some time each day watching TV shows or movies that you find funny. Forget about life for a while and just laugh. As Dr. Dent mentioned, social supports are really quite important. Human beings are social beings. We're not meant to be alone or isolated. We all need our social connections and supports. Although again, we may vary somewhat. Introverted individuals might need a bit less, extroverted a bit more. So having and accessing social support systems helps one deal with stress. And I often, when I'm working with individuals, whether they're dealing with HD or something else, if they're experiencing a stressful circumstance, one of the conversational pieces is always, who is your support system? How can you develop your support system and access that? So who are the people in your life that are there for you? Who are the people that are part of your social network already? Your family relationships, your friendships, perhaps work relationships. Who are the people that are there for you? And are you reaching out to them often enough to meet your social support needs? There's also HD specific supports. The support groups, conferences like this are all very helpful. And if you're interested in learning more about opportunities, I would suggest that you contact Debbie, the social worker. She's a good resource for things that are available. I think it's fair to say that if these basic needs are not being adequately met, each of us will have a hard time coping well with the normal ups and downs of life, and perhaps even more difficulty coping with unusual ups and downs or stressful circumstances such as the HD experience. So let me invite you to spend some time over the next couple of days considering, what type of plant are you? What do you need in your life to help you survive and even thrive? As your own personal gardener, does your soil need to be tilled? Perhaps some weeds pulled? Perhaps some modifications made in your routines or your activities so that you can function better? Again, I invite you to consider these things in your life and then perhaps make some changes as you see fit to help you cope better. Next, I'd like to look a little more deeply and share a few stories that might help flesh out some of these ideas. These stories are about real people, people like you and me, people who found themselves in difficult situations, situations that they did not choose, and for the most part did not want. And like you and me, they had to figure out how to deal with their situation, how to survive and thrive in these difficult situations. First, I'd like to tell you about a friend of mine, Vic. Vic was a young man who was enjoying an amazing life, really. He lived in Vienna, Austria in the 1930s. He graduated from medical school, trained as a psychiatrist, and was working and enjoying the start of his career. He got married to a loving, passionate young woman. And then quite suddenly in 1942, he, his wife, his parents, and his brother were arrested by the German SS and taken to a concentration camp. His father died of pneumonia within a few months. In 1944, Vic and his family members were taken to Auschwitz, where his mother and brother were gassed and died. His wife died later of typhus in the Bergen-Belsen camp. Vic spent a total of 3 years in 4 different concentration camps. Remarkably, he survived and was eventually freed at the end of the war when his camp was liberated. I was first introduced to Vic when I was in college and read his autobiography, a book entitled Man's Search for Meaning. Through this book, I learned that while he was at Auschwitz, Vic and fellow prisoners focused their time and energy on the people around them. They tried to respond to the despondency and hopelessness that they observed. They tried to prevent suicide attempts by encouraging severely depressed people to reflect on the positive memories that they had, to imagine positive scenes they had experienced and relive happy moments in their lives. Vic believed that even in the midst of the most dehumanizing and atrocious circumstances, life still had meaning and a person could find purpose. What was most remarkable to me was Vic's thoughts about how to deal with these difficult situations, the hard, painful situations that we do not choose and would rather not have. Vic believed that the most important thing in a person's life is to have a sense of meaning and purpose. What human beings need most of all to survive and thrive in any situation is meaning and purpose. If we have meaning and purpose, Vic believed that we could live well regardless of our circumstances. Through his efforts to help these severely depressed people around him, Vic observed that those who found a way to endure and not give up always had a sense of purpose that carried them through difficult times. For some, it was the memory of their child and the belief that their child would be waiting for them once they were liberated. For others, it was a spouse or a family member that they dreamed of reuniting with once they were liberated. For many, it was an unfinished task, a life goal, a creative project that was very important to them, and their belief that their life would not be complete if this task was not finished. Each person had or found a purpose, a promise, something calling them forward. What is your sense of purpose now as you live with HD? And Vic believed that one of the most powerful, one of the most sustaining of all human purposes is love. He says in his book, the salvation of man is through love. He's not talking about the sugary, sweet love that we might see in our modern music and movies. He's talking about the harsh realities of life that he experienced in the concentration camps. He points out that love shows up and expresses itself in the service of others, often small, daily acts of care and service. In this experience, humans find a purpose. I call Vic my friend because even though I've never met him in person, his life experience, his way of being in the world has touched me deeply. It's the only book that I read in college that still stays with me in a very real way. So now in our situations, including living with HD, our friend Vic would have us consider the nature and quality of our human interactions. How do we respond to those around us? Do we live and breathe love? Do we share love? Do we accept love? Do we engage in those small daily acts of care and service? Do we show up in loving service for those around us? And do we humbly accept their loving service of us? Because you see, we can all show up in love and service, no matter what our circumstances are, no matter our age, or our gender, our skin color, our level of education, no matter our health, if we have HD or our family member has HD, we can all show up in love. We can all give and receive loving service of others. So let us take time to consider in our circumstances how we might increase our self-care by better serving others. How can we enrich our lives through the experiences of giving and receiving love? I invite you to take Vic home with you. Let his life and his example begin to influence you like it's influenced me. Let it influence how you think and how you feel, how you live, and how you love. If you'd like to learn more about Vic, most people refer to him as Viktor Frankl. You could Google him. And again, his book is Man's Search for Meaning. Next, I want to tell you about another friend. This gentleman's name is Tim. Tim is my brother, actually. He's 13 months older than me. Like most siblings who are close in age, we grew up in what I refer to as a love-hate relationship. Thankfully, over the years, life has mellowed both of us, and now I think of ours as a love-love relationship. I do consider him one of my dearest friends. We live about 500 miles apart, but have frequent contact over the phone and visit each other often. Tim was living his rather normal life, doing fine in his work, and experiencing positive relationships with his family and friends. Really nothing all that remarkable. At the age of 64, he still enjoyed playing softball each summer, something he has done every summer since we were adolescents. Fortunately for him, age hadn't taken away this dearly loved hobby of his. But as I've pointed out to him, it has certainly slowed him on the base paths. While he used to be able to turn singles into doubles with his base running, now he turns doubles into singles. Then, as so often happens with us human beings, Tim unexpectedly found himself in a very difficult situation, a situation he did not choose and would much rather not have experienced. He was diagnosed with esophageal cancer. If you're unfamiliar with this, it is a relatively fast-growing cancer and has a poorer prognosis than many of the other cancers. Tim had a round of chemo and radiation, and then he and his doctor discussed the possibility of surgery. He was told it would be complicated and high risk. He was told that he had a 5% chance of dying in surgery, and there could be a variety of serious complications. He asked what would happen if he didn't have surgery, and he was told that he very likely would die within a year, perhaps less. I really liked his response. He said, "So doc, you're telling me I have a 100% chance of dying without surgery, a 5% chance of dying on the table, and a 95% chance of continuing to live. I like those odds, I'm in." As surgery approached, he and I talked about his thoughts and feelings. He said he was accepting of his situation, that these things happen to people, and it was just one of those things. Now it was his turn to experience what so many others around him have experienced. And he mentioned that a situation would bring him new experiences. He would undergo things and experience things he's never had before. He'd never been seriously ill. He would never had a serious operation. So now he would be operated upon and have a hospitalization and a long recovery. He hoped that this would deepen his sensitivity to others and his compassion for what others went through. Frankly, I thought his response was a bit simplistic, even naive. So a couple days later, I asked him again about how he was doing, and I asked specifically about how he was feeling about the risks he was facing. His response was quite realistic. He said that he knew he could die in surgery. In fact, he'd made preparations for dying. He made sure his will was up to date, his life insurance was in order. He'd written goodbye letters to his kids and put together a list of his accounts and passwords to make things easier for his kids. And he said that he wished he didn't have to go through with this. But that wasn't reality. It's already here. This is already happening. And there was nothing he could do to stop it or make it go away. So he was trying to focus on the positives that might come from this for himself and others. He was seeing it as an opportunity for him to learn and to grow and become a more loving human being. And I believed him. He had a surgery. He had been told that if all went well, he would be in the hospital for about 2 weeks. He survived the surgery and was progressing well for the first week of his recovery, and then the complications started. I was with him during the second week after surgery as things began to unwind. As things unfolded for him, he remained in the hospital for 12 weeks rather than 2. He had 2 additional very significant surgeries. He almost died several times. Once the surgeon said he probably had about 12 to 24 hours to live, but he pulled through. By the time he left the hospital, he'd lost 75 pounds. He could not digest food and was discharged with a feeding tube, He was too weak to feed himself. And for several months, several of us lived with him and did his tube feedings with him. I was with him for about 3 weeks during this phase. Also, his vocal cords were paralyzed as a result of having the feeding tube down his throat for so long. He had 2 more surgeries after he was discharged to help correct his vocal cords. It was somewhat successful. His recovery has been slow and steady. He's now able to eat and digest regular food. Although his weight has slowly increased, he's still about 25 pounds below where he was when he was diagnosed. Happily, he played softball again this summer on a team with his 2 sons. I was able to be at one of their games. It seems to me that he now turns doubles into groundouts. And he sings about as well as he always has, which isn't very good. Throughout his ordeal, Tim has had an openness to the unfolding of his life. He's had an acceptance of reality, of the uncertainty of his situation. He has said several times that he is aware that he's not going to live forever and that he's lucky to have lived as long as he has. He has said that he sees how the experience has enriched his life. He's living more in the moment now, not dwelling on the past or worried about the future. He feels this experience has opened his eyes to so many things. He's so much more grateful for his children and his grandchildren, his friends and his family. And he has a deep inner peace. He says now with regularity, "It's a great day to be Tim." Tim's experience is different from the experience of HD, but there's an important similarity. Tim found himself in a very difficult situation, one he did not choose, one which he could not avoid or escape, and one which he had to deal with. Walking this journey with Tim has taught me several important lessons. The first is the value of accepting reality as it is, and not spending much time wishing that reality was different than it is. Accepting reality as it is has been a way for Tim to take care of himself. It has been a process of self-care. Another thing I've learned from his experience is the value of living in the moment, even if the circumstances of the moment are not the ones we would prefer. Staying focused on the present, not dwelling on the past or worrying about the future, has been another way that Tim has taken care of himself and engaged in good self-care. Third, Tim's experience speaks to me about the fact that life is always mixed. There are positive circumstances and negative circumstances mixed in every situation. Dwelling on the negative tends to bring us sadness, regret, fear, hopelessness. Focusing on the positive tends to bring us relative happiness, gratitude, hope. Focusing on the positive and practicing gratitude has been a way that Tim has taken care of himself. It's been a process of good self-care. Finally, Tim does know that I'm sharing some of these thoughts about his journey with you today. And I asked him if he had any tips for how you and I might accept reality and live in the present with gratitude. He said that for him, it has been very important to make and take time and space for quiet, some time for self-reflection, for meditation, time to focus on the positives that are in his life. This has been very important for him. He believes that this is what has been most helpful to him to keep balance throughout this difficult process. So I invite you to consider your situation and your circumstance through the lens of Tim's experience. Can you care better for yourself by accepting your reality as it is? Can you care better for yourself by staying focused on the present, not dwelling on the past or worrying about the future? Can you care better for yourself by focusing on positives in your situation and choosing to practice gratitude? I have a third story to share with you. This gentleman's name is Bill. Bill and his wife moved here a couple years ago to be closer to their daughter, and they moved in right next door to me. They don't have any good friends here. They left them behind where they used to live. And his wife was in the early stages of Alzheimer's. Bill and I had a reasonable neighbor relationship. We engaged in regular chats over the fence. We were friendly, we shared laughs, but we never really became close friends. It was a casual acquaintanceship. One day, one yard chat changed everything. I hadn't seen him in a few weeks, so I approached him to say hi and to chat. I learned from him that he was recently hospitalized and diagnosed with a terminal cancer. He was told he only had a few months to live. His wife was moved to an assisted living facility when he went into the hospital, and he and his daughter agreed that she should stay there because she couldn't live safely alone once he passed. I offered to Bill that I'd be happy to check in on him from time to time to see if he needed anything, and he was quite welcoming of that. After a few brief visits, I wound up visiting him more often, and eventually I sat with him for about an hour a day, every day, until he passed, which was about 4 months later. His daughter and her spouse also were with him almost daily. We were his support system as he journeyed through his final days. I thought of my friend Vic during this time and thought perhaps I could reach out to Bill in these small acts of service to help his final days go better for him. As things unfolded, Bill and I talked a lot about our lives and got to know each other very well. Various experiences, our families, our journeys through life. We were very different. We're on the opposite ends of the political spectrum in what is currently a very conflicted culture, as you all know, but that never seemed to matter. We shared a lot together. He was always so grateful that I stopped in and visited. And I always felt that I received so much more from being with him than I gave him. The experience of our daily chats gave me time and space to reflect. I reflected on how fragile Bill was as I saw him decline before me, and how fragile I am. I reflected on how unpredictable Bill's life is, and how unpredictable my life is, how none of us are promised tomorrow. I reflected on how important it is to live our lives one day at a time and to be grateful for life as it is. I was sad to see Bill pass. We've become good friends in a short time. And I want to share one fourth story with you. Again, a circumstance of an individual who had a very difficult circumstance that he didn't choose and wouldn't have wanted to have. This fellow's name is Andy. He was my brother-in-law. He was diagnosed at the age of 14 with cancer in his leg, and he died when he was 17. Over those 3 years, he had multiple rounds of chemotherapy. Eventually, his leg was amputated above his knee. I didn't know him well because I wasn't living in the house with him as this was unfolding, but I heard a lot about his situation and was with him from time to time. The last year of his life, he had many arguments with his parents. Mostly, he argued about his interest in participating in school activities with his friends. He wanted to go to the football games and the basketball games. He was 16 after all. He wanted to go to the homecoming dance. He wanted to get his driver's license. It seemed to me that he wanted to live. He wanted to be a teenager and do what teenagers do. His parents knew his life was short. He didn't have long to live. And they were very concerned about his safety and his compromised immune system. So they often found themselves saying no to his requests. And the arguments would ensue. In one argument, he yelled at his parents, "I'm not dead yet. I want to live." Andy's life and experience taught me a few lessons: how important it is to live in the present, and how important it is to continue living as long as we're still alive. So that's the information I have to share about stress and coping with stress and stress reduction. As I said in the beginning, there's a lot we could talk about. We could devote an entire weekend to this. I think the pieces toward the end are probably more important than the pieces in the beginning, but I think they're all important. how we live, how we think. Are we in the present? Are we living with gratitude and hope? It's how we think about our lives and our situations that really mean the most. We have about 10 minutes or so left in the time that's been allotted. I'd be happy to respond to any questions or share any conversation that people might wish.
Currently, there are no questions in the chat, but I was just wondering after listening to your presentation, do you have a sense, or did you talk about with the people that you highlighted, your brother, and Andy, did they have difficulty asking for or accepting help?
That's a very good question. I think that they all had difficulty asking. I think that's a common theme. My brother, who probably was the most accepting of help, accepted it when it was offered, but he did have difficulty asking. There were a couple times in that second week after his surgery when I was with him alone in the hospital, and he would ask me to stretch his legs or do things for him. That's the only time I ever experienced him asking. So yeah, I think that's a very common concern.
Would you have any suggestions on how to offer help to someone maybe that's going through a crisis or a health condition?
I have a few thoughts about that. I guess my first thought is every person in every situation is different. And so I think it's helpful to tread lightly. Some people will be welcoming of help, some will not be welcoming of help. I think making comments generally from time to time, like, I'm here for you. If there's anything you need, I'll be happy to help you. Giving those kinds of reassurances in a general sense from time to time can be helpful. And then if you're seeing that the person's having a struggle, asking if they want help. I wouldn't, unless it's a sort of a dangerous situation where maybe they're falling and they need help right away. But I would really try to respect their wishes for how much help they give or how much help they receive. Because I think people, regardless of the situation, when you're dealing with a health problem or a disability, maintaining our sense of self-respect and our integrity and our autonomy are really important. So again, offering and making questions and being willing to help.
Does anyone have other questions or comments? Oh, we do have a new message that came into the chat. A little different angle here. Our daughter is dealing with extreme stress and anxiety right now. She is in her late 20s and is terrified of being tested for Huntington's. Besides reassurances and letting her know we're here, can you think of anything else we could do or say?
Well, yeah, I think that more information is always helpful, at least in relieving some of the anxiety, because often the anxiety is a focus on the unknown, right? So perhaps chatting, talking with a genetic counselor about all the possibilities might be helpful to open the door a little bit. Talking with a counselor, social worker, psychologist who's somewhat familiar with the circumstances might be helpful. I think that without knowing the person and without knowing the circumstances in more detail, it's hard. But I guess I would say reaching out to people who might be able to give her more information in a way that respects her freedom to choose would be helpful. Mm-hmm. And parents may not be the best person for that because, all the family emotions get kind of tied up in that. And so somebody more independent and objective might be helpful.
Perhaps our social worker, Debbie, might be a
very
good resource for that.
Yes.
Okay. And then another comment question. My husband has HD early stage. How can I motivate him to exercise and do things without constantly bugging him to do it?
I know people who don't have HD early stage who are not motivated to exercise. I Again, I think there's a question of autonomy and respecting their wishes. I think that information from others, from his physician or whatever about the benefits might be helpful. If he's had a pattern of exercise in the past that he's enjoyed, seeing if he can resume something like that, like maybe he used to enjoy, I don't know, riding his bike or walking, if he can still do those things, looping back to things he's enjoyed in the past. Or maybe exercising in ways that aren't really exercise, like just going for a nice walk in the park. It's getting colder now, but just being more physically active can be helpful. It sounds like it's more of a matter of motivation and perhaps mood, perhaps discouragement. I don't know. So I think talking to people about those things might be helpful.
I know when I was a caregiver for my brother who had Huntington's, and when he was still living on his own, there were times when I get really, really frustrated. He was seeing the world in a very different light than I was seeing it. And I didn't want to argue with him, but yet I didn't want to see him doing things that possibly weren't the best for him health-wise. And I struggled with that. Would you offer any suggestions about how to deal with that immediate frustration when you're there in the moment?
Well, I think, that's an issue with anyone with a sort of chronic health problem. And I think of people I've worked with who've had diabetes who aren't always willing to take their insulin or other health problems. I think there's often a lot of issues going on there, accepting reality, facing the circumstance, being realistic about it. But I think we have to, again, respect people's autonomy. People have a right to make their own choices, and we won't always agree with those choices, and we might wish that they would make other choices. But I think that it's their life, it's their body. And I don't mean to turn away and not be attentive, but more information to maybe help him understand the consequences or the risks would be helpful. I think, again, though, at the end of the day, a person has the right to make their own choice, and we have to respect that right.
Thank you.
That's very helpful. It's pretty general, but.
Oh, everything is helpful. Don't worry about that. Does anyone else have any other questions or comments?
I appreciate the opportunity to be with you today, and I hope it was helpful.
Oh, I think it was. Vicki, I'm seeing you on the screen. Do we want to take a shorter break? And are we able to start the dental session a little earlier? Okay, so if we take a break now and start back in 10 minutes, so if we start at about 2:30?
Yeah, I think let's do that.
Okay, that sounds great. And there's another comment, a couple of comments. Thank you so much for sharing, and thank you for your answers and your stories.
You're welcome.
We really appreciate
You're very
it.
welcome.
Love that this was very informative.
Good. Have a nice day. Thanks.
Thank you.
Stop. There we go. She's worked in private practice and has had many years of experience caring for the oral care of dependent elders in long-term care facilities. She's also a dental hygiene instructor at NWTC in Green Bay, where she loves educating future dental hygienists to be compassionate and caring. We're very, very happy that Kathy's joining us today. Kathy and her husband are raising their 4 daughters. That must be a lot of work on a mini hobby farm, complete with chickens, pigs, and bees. That makes me want to come visit your place. Thank you so much for joining us, Kathy, and we'll hand it over to you.
All right. Well, thank you, Vicki. Let's see if I can share my screen here with everybody. Okay. So can everyone see? Are we good? Can you see my screen?
Yes.
Okay. So yes, thank you for having me today. I'm really excited to be with this organization and be able to talk about my passion and hopefully share some of my knowledge and just give you guys some tips on why our teeth are important throughout our life and through disease processes as well. So yes. As Vicki mentioned, I'm a hygienist. I've been in the field for about 2 decades, and not a big deal. But throughout my career, I was raising my oldest daughter at the time. My mom was diagnosed with a stage 4 cancer. So being a young mom and a daughter, I quickly had to transition from being a daughter to a caregiver. And that kind of made me change my career path a little bit and just made me a little more interested in caring for people that can't care for themselves anymore. So my career kind of shifted, and my passion really lies in helping people that can no longer care for their oral hygiene. And so I'll talk a little bit more about that at the end of my presentation, but just some things that I want to talk about today are just talk about, just a trip around the mouth, just connecting our mouth with the rest of our body, talking about some of the systemic effects of poor oral health and how they do affect our whole body. I'm going to touch a little bit on Huntington's disease. I am by no means an expert on that, but just helping bring some of my experience to help with the Huntington's care and caring for the teeth as the disease progresses. So just giving you some tips and tricks on some oral care plans, some modifications that you can hopefully take with you and use if you need to. So our mouth is our primary connection to the world. It's how we take in nutrients. It's how we, drink water. It's also our primary means of communication. And I feel like when something is lacking in our mouth, it can affect us nutritionally. We can't take in the food that we need to for our body to sustain life, but also from a social aspect, it can affect us. If our mouth isn't looking good, we're not going to be smiling as much. We're not going to want to go out and all those things. So it is really important to maintain our oral health as we progress. And it's also kind of a viable sign of our mood. If, you can see if we're frowning and things like that. So it's really good to pay attention to the mouth and how it affects the rest of our body. I like to put this slide in just because obviously everyone notices the missing tooth. Our eyes are drawn to that right away. But I also like to point out that this gentleman is also missing an eyebrow. So just, the mouth is something that our eyes just go to it right away. So very important thing to keep things healthy. Oral health is an essential and integral component of our overall health. More than 700 bacteria can habitat in our mouth. They can be pathogenic and non-pathogenic, but they have the potential to affect our whole system. So it is really important to keep our mouth healthy, to keep our other systems working well. So just to, show the different parts of the mouth. I know some of these slides might be kind of gross to some people, but, it's not just our teeth. When we look at the mouth, we have our lips, we have our gums, the teeth, we have the hard and soft palate, we have our tongue. There's also our lower jaw, our maxillary jaw, our sinuses, our oral pharynx and neck, all the muscles that, it's all a moving system, and there's a lot of working parts that that are involved with oral health and with dentistry. So it's a lot more than just teeth. So typically throughout my career, I've seen a lot of disconnect between oral health and the healthcare field. I think that we've made a lot of progress through the years of kind of bridging that gap. And I feel like me being here makes me feel like we're getting closer. And I'm super thankful to be able to share my knowledge with everyone today. But just having this platform, I want to tell everyone that I'm going to take some of this information that I've learned today and bring it back to the dental community, because I feel like coming into doing this presentation, there wasn't a lot that I knew about Huntington's disease. And I feel like I can, bring some of this information back to the dental people and, do some education there too. But we really do need to work together. The healthcare and dental really need to be a team, because everything is connected, like I said, and you're going to hear that a lot from me. But that is one of my life goal in my career, is to really work together with the medical community to be able to work together as a team to make people healthy. So just an outline quick of some oral systemic links to overall health. I'm going to touch on some things, the periodontal infection. So periodontal is what we refer to as gum disease. That can lead to an increased risk of heart disease. Periodontal infections or gum infections can also complicate the control of blood sugar for people with diabetes. We're going to talk about that a little bit more in detail. And then aspiration pneumonia, our lungs. There's definitely a close proximity between our mouth and our lungs. So keeping our mouth healthy is going to definitely help keep our lung health in good shape as well. So heart disease. So there is definitely a connection. There are studies that are out there right now. There isn't an exact study that shows the direct connection between heart health and mouth health. But we do know that periodontitis is associated with an increased risk of heart disease, and poor dental health increases the risk of bacteria infections in the bloodstream. So I like to put the analogy out there that, if like the palm of our hand is about the surface of our mouth, if we had an infection on our hand and we were walking around, we definitely wouldn't let that go. But with it being in our mouth, we might not necessarily, we have an infection, because mouth infections or gum disease typically does not have symptoms per se. You don't have pain with it always, but it's easy to kind of brush it aside and not acknowledge it. If it was out there on our hand, we would probably get it taken care of. But with our mouth, sometimes we kind of neglect it. But it's really important to keep our mouth healthy, to keep our heart healthy as well. With diabetes, there is definitely a link between having diabetes and being more at risk for having gum disease or gum infections. There's about 29 million people in the United States that have diabetes. And again, this definitely puts you more at risk for having gum infections or periodontal disease. When bacteria collect on the teeth, plaque and tartar start to form on our teeth, and toxins start to develop from the bacteria that form around this buildup on our teeth. So those toxins, they create our body a response that we try to fight that off. But what happens is our body starts to break down our own tissue. And what happens is the tissue and the bones start to deconstruct or kind of go away. And with being diabetic, we can't fight these bacteria off as well. So we're definitely more at risk for having gum disease. If I have a diabetic patient that I see in the dental office, and if they're not under control, meaning their A1C is over 7, I typically will have that patient on like a 3-month schedule. They come in every 3 months to get their teeth cleaned. The studies have shown that this frequent visit of disrupting that bacteria in our mouth, that really can help control the gum disease, and it actually can help have better diabetic control as well. So it's really important for diabetic patients that we keep our mouth healthy and really stay ahead of it. The last systemic link that I will talk about is our lung health, and particularly aspiration pneumonia. As you can see, our mouth is pretty close in proximity to our lungs. And what happens is when our mouth, we get that bacteria build up in our mouth, that can actually, studies have shown that can travel into our lungs and cause a pneumonia type reaction. So aspiration pneumonia accounts for the majority of admissions to hospitals from long-term care facilities like nursing homes especially, and it's the leading cause of death in nursing home populations. So we typically, unfortunately, know that when someone enters long-term care facilities, their oral health really declines. So just really want to reiterate that daily oral care is really important to keep these other systems of our body really healthy and prevent some of these really serious conditions from happening. Everyone knows about dental caries or dental cavities. It's not just for kids, and in fact, as we get older, our cavity risk starts to increase because our gums start to recede down and we start to get cavities on the roots of our teeth now. And the roots of our teeth are actually softer than enamel, so they can progress quicker, cause more issues. So you can see some of the stats I have up there, just that that root surface cavities is starting to be an issue with the older population, and if there's other diseases that are going on. So just some other infections, we all have heard gingivitis. So that's just basically some inflammation of the gum tissue. There can be swelling and bleeding with that. With gingivitis, that is reversible because there is not bone that's being destructed with it. So if we can treat gingivitis early on, we can stop it. But if gingivitis doesn't get treated, what happens is the bacteria starts to build up more and more, and it progresses deeper into the tissue, and it turns into periodontal disease. So periodontal disease is no longer, we can treat it, but we can't reverse that bone destruction. Once our bone starts to recede down, unfortunately, we cannot get that bone back. But what we can do is we can treat the infection and kind of maintain it. Just like diabetes, it's kind of like one of those things that it doesn't go away. We're kind of always working at maintaining it every day. We're working at our daily brushing. We're going to the dentist. We're, disrupting that bacteria every day. So just because you have gum disease, it's not like a death sentence. It's just something that you have to work harder at to kind of stay healthy throughout your life. So just shifting from all that gross mouth stuff and shifting into a little bit more of Huntington's disease and the effects on our oral health. So the biggest thing that I found while researching some of the Huntington's information was our impact on daily living, the movement, cognitive, and psychiatric concerns with the disease, and also the polypharmacy, just the medications that are prescribed with Huntington's disease. So the cognitive concerns, difficulty organizing tasks and difficulty learning new information. So I think the biggest thing with those is just keeping a priority of taking care of yourself. Self-care is really important every day. Remembering how to brush and floss our teeth. Just doing those daily routines every day, not changing anything or making new suggestions. Stick to what they're used to doing. Don't try to revamp and do this whole new thing. If they like brushing their teeth while watching TV, great. Keep doing that, or flossing during a different activity. Just do what works. Don't try to reinvent the wheel. So some of the psychiatric disorders, the depression and anxiety definitely are going to place a toll on oral care. So just, keeping that recommendation there at least, and keeping the supply of the toothbrush and everything able and there for the loved one with the disease. and working through that aspect of it. Another big concern with Huntington's disease is I've learned there's not a cure for it, and there's treatments that can help some of the symptoms, and we definitely need these medications. It just complicates things a little bit more with the mouth, because there's always going to be side effects of medications, as we know. So when I did the research here and looked up some of the different medications, the medications to control movement, some of the antipsychotics and the other medications, I looked up each of these just to see, as I would in the dental office, just to see what medications you're taking and looking at those side effects that can cause some negative effects on other systems in our body. But as you can see on my list here, as I look through each of those medications, you can see, I think dry mouth came up, I think 6 times out of, a dozen there that I have. So dry mouth is a very big concern in the dental office and in your mouth, because what saliva's role is to keep our mouth moist. It keeps our mouth in a more of a basic or neutral environment. When we lack saliva, our pH of our mouth drops to more of an acidic level. And when this happens, the acid and the bacteria, it's kind of like a wildfire. Also, with brushing maybe not being as good as it once was, it just creates a wildfire for things to go south very quickly. The root cavities, not being able to eat the healthy, nutritious foods and going to more of the soft, high carbohydrate foods, just creates kind of a wildfire for an issue of problems to occur. So if this is something that is occurring, you definitely want to relook at some of the products that you're using and consider, talking with your dentist or your hygienist about what products can I switch to that can help the dry mouth. There's prescriptions that can be given, but there's a lot of over-the-counter things that are pretty inexpensive that can help stimulate saliva, help protect the teeth. So we'll talk about a few of these products at the end here. But dry mouth is a really big concern with your teeth. All right, so what are some things that that you can do every day? The biggest thing is just really trying to stick to that daily oral care. Again, work with what has worked in the past, but really striving for twice a day, brushing. If possible, the dental visits, if we can maintain that 3 to 4 times a year. Fluoride is super beneficial, especially if there's issues of the dry mouth. And then just making, minor modifications with your, the different products that you might be using. So I just have a few pictures up here of some of my favorites. Brushing, this is a toothbrush that I found on Amazon. It's called Dentrust, and it's pretty inexpensive, but what it is, it's a really toothbrush, a really nice toothbrush that is modified for, it was actually, I think with autistic people, it was really beneficial for caregivers and for autistic people to use. But what it is, it's a toothbrush that covers the outside, the inside, and the chewing surface of the teeth all at once. So it really helps if a caregiver is brushing someone's teeth, it gets, all sides of the arch in, one kind of stroke. So it kind of eases up brushing the outside, brushing the inside, brushing the top. So I really like that one. In between is really important to keep doing every day. Flossing obviously is hard for most people in the general population. When you add in a disease, it makes it even harder. So I really like these. They're called Prexy brushes, and they're just like a little brush that you can go in between the teeth and just disrupt that bacteria and keep that in between the teeth area clean. The spray is another good product. We'll talk a little bit more about that. So just with toothbrushing, again, really recommending that 2 times a day if you can. The electric toothbrushes are really handy just because they have the larger handle. So especially in the early stages of Huntington's disease.
Kathy, your mic must have slipped. You're sounding a little muzzled. Sorry.
Okay. Let's see here.
Nope, I think you're better now.
Okay.
Yep, you're sounding good again.
Okay, just let me know. All right. So yeah, like I was saying, the electric toothbrush, I wouldn't introduce that if it isn't something that's been part of the routine, but certainly if it's something that's been used in the past, I would keep using it. You can make other modifications to a toothbrush. I've seen people put like a tennis ball on the end of a toothbrush handle just to make it bigger to hold on to. Wrapping a washcloth around the toothbrush handle are all things that can help just to hold that better. Again, there's those specialty toothbrushes that make life a little bit easier. And then the products. So one of the things to try to avoid with, especially if dry mouth is a concern, you want to avoid products with alcohol. A lot of people feel like, oh, the burn is good, the alcohol burn is killing stuff, but it can actually be harmful to the tissue. So you're going to want to avoid any rinses with alcohol if you can. And then also sodium lauryl sulfate, you'll see that in ingredients in toothpaste. And that's actually like the detergent part of toothpaste. It's what bubbles up on the toothpaste and, you know, makes it feel like it's clean. But it can be also abrasive to some of that sensitive tissue if it's the tissue is dry and sore. So you're going to want to avoid those types of products. And then the foam ended products, I don't like either because they're like glued onto a stick. And maybe there's some better ones out there now, but they're just not my go-to. Xylitol is a really great product that if you're not using it in this disease, it's really a good thing for the mouth. So xylitol is a sugar alcohol that has a different chemical structure than table sugar or sucrose. And what xylitol is so when we consume it, it's sweet. The bacteria in our mouth cannot digest it. So the bad bacteria, they're eating this, they eat it up, but then they can't digest it, so they die off. So it leaves room for the good bacteria to kind of take over in our mouth. And xylitol is a natural occurring sugar. They make it from birch bark. I think it's also in corn husks. So it's not a unnatural, it's a natural sweetener. You just want to be careful with it with dogs. It's not, it can be poisonous to our pets. So that's the only thing, but it's really good for someone who has dry mouth, just to help stimulate more saliva and help bring that pH back up. So you'll find a lot of different products over the counter. You can find it on Amazon. There's gums, there's mints, there's toothpaste, there's mouth rinse. There's a number of different products. But it is just a really great natural sweetener that can really help keep the mouth healthy instead of sucking on a candy or something, and that's just going to create cavities really, really quick. So what to look for in the mouth. Again, we talked about dry mouth. You may notice the mouth appears dry and red and kind of inflamed. Ulcers can develop kind of on the lower lip especially. That's not uncommon. Mouth odor is something that occurs as well. The tongue and palate, you may notice buildup forming. There may be dry crusted saliva on the tongue and palate. These are all signs that, you know, probably the saliva is reduced, and there's there can be some candidiasis or like a yeast buildup on the palate. These are all things that you would want to bring to attention to your dentist. And then that decay is something, the cavities that can happen. So just brown and black spots on the teeth that are a sign that there's some progression of some cavities in there. So this is just showing some, we call this angular cheilitis. So this is just almost like a yeast infection again in the corners of the mouth. you would want to mention that to your dentist. There's different things over the counter that can be used for that. This is like a canker sore on the upper right, and then the lower right would be like how an ulcer would look. So all these things you would just want to bring to the attention of the dentist or hygienist. Just some other tips. I'm almost done here, so thanks for bearing with me. When brushing, just avoid the big ribbon of toothpaste. I swear that's toothpaste manufacturers' way of getting us to use more toothpaste that we don't need, because it just typically will drool out. So err on the side of a pea size, just really, really small. It's all you need. Again, this is a product, they're called Basic Bites. They're a sugar-free soft chew for someone that is having the dry mouth issues. They actually taste really good, and they just help stimulate some saliva, bring that pH back up in our mouth. I talked about the toothbrushes and the proxy brushes. Closest is a really great product that I really recommend. And also this Moisten is a dry mouth spray that is really helpful to the tissue and making our mouth just feel moist and not that dry, uncomfortable feeling. So this is me with one of my clients that I take care of. I started my mobile dentistry, Hygieia, just about a year ago now. And what I do is I have a mobile dental unit that I wheel right into dependent homes, and I provide oral care to those individuals. So my mission with Hygieia is to improve the quality of life in the dependent population by addressing the oral health needs with care and compassion. So we bring healthcare right to your door. You don't have to travel to the dentist. We try to take that aspect out of it. We also use teledentistry. So I'm working with a dentist where I can, take the photos and then send them back to the dentist, and we're able to work together to, get a plan for that patient. So that is where my passion is, and that is about it.
Kathy, we did have a couple of questions.
Okay, good.
So I'm just getting them to show up here now.
Okay.
Okay. My hygienist recommended dry brushing to help eliminate plaque. Any comments on that?
Yes, so I have recommended this as well. So the thought behind the dry brushing is that the bristles are a little stiffer. The no toothpaste, it doesn't, it just makes your bristles a little more abrasive. So I always tell people to do this, especially on like the bottom inside where we tend to get that tartar buildup, is to start there with a dry toothbrush, and then you can brush all your teeth with the dry toothbrush. Actually, you really don't need toothpaste. The toothpaste does have added benefits of the fluoride, the minty feeling, but really it's more about that mechanical action. So that's really a great tip that I tell patients as well. So yeah, that's something I do recommend.
Okay. And then another question, what is the specialty toothbrush called again? The one that got all aspects of the tooth?
Yep. It's called Dentrust. So it's DENTRUST.
Do you know where you could get that?
Yeah, I got it on Amazon. If anyone goes on Amazon. Sure.
Like all of us probably.
Yeah.
And then make it Amazon smile.
Right, exactly.
So, okay. And then that xylitol you were talking about, now, is that actually like a sugar substitute, or are you just recommending it to like use with that gum product that you showed?
So you can use it as a sugar substitute. It is safe for diabetic patients. It does not raise the blood sugar. So, it just depends if it's something that you want to replace sugar. There's certain things that you can't bake bread with it because the yeast doesn't react with it. But you certainly can use it for baking. I've tried doing it with my kids and they always know that I'm trying to be healthy because it does have a little different aftertaste. So I've tried. It doesn't always work as good, but maybe someone can find the right recipe.
Sounds good. And then do you know, is it like a lower calorie than the xylitol?
Yeah,
Or
I
just-
believe so. Yeah, I believe so. I'm not sure the exact number, but I would have to look it up because
Okay.
it is safe for diabetics. So, but that would be something that you would want to check with your doctor on.
Right. And then would you get that on Amazon as well,
They do.
perhaps?
Oh, sure.
Okay.
And you can find a lot of the xylitol products if you go to like a new like a vitamin store, you know, wherever they sell like vitamins. They're going to have a section of all kinds of xylitol stuff, and you could ask, you know, the person there. They'd have a lot of information on it as well.
Okay. And then Prevident prescription paste recommended with or without usual toothpaste, or no, none at all?
So the question is using the Prevident by itself.
Prevident prescription paste, are you supposed to use it with or without your usual toothpaste?
I guess it depends on that individual. When the office I work at, if we're prescribing a prescription toothpaste, it's usually because that patient is really at a high risk for, you know, getting cavities or has had a lot of tooth decay issues or has dry mouth and all these other conditions. Typically, we'll recommend it twice a day. But if, you know, it just depends. Sometimes you can, if you like to use your other toothpaste, I usually tell people use your regular toothpaste in the morning and then use the prescription at night. That way you're getting that through the nighttime, that toothpaste is soaking into your teeth and you're getting the full benefit there too. But it just depends.
Okay, and maybe something to ask your dentist or your own
Yes.
dentist about how
Yeah.
they would prefer you to use it. Okay. And then the basic bites that you were referring to chew to help with the dry mouth,
Mm-hmm.
are those like a real sticky? Are they like a toffee, or are they more of a harder substance? I'm just trying to think of someone who's having some issues with Huntington's, with chewing and everything. Is it going to stick to their teeth more, or?
They're I've had them and they're softer. I'd say they're kind of like you know, like a what do I want to say? Like what is it that kids eat? The little like fruit bites, like I'm
Oh,
drawing.
the
Just like
gummies or the fruit chews.
yeah,
Fruit
they're
snacks?
similar to that. So they are a little sticky, but they dissolve easier. They're the formula of them, it doesn't stick to your teeth. And if a little bit does stick, it's really, it's not gonna like, it's not a sucrose that's on the teeth. It's a healthy sugar, so it would be okay. So
Okay. Oh, cool. Does anyone else have any questions for Kathy yet? I'm not seeing any in the chat. If anyone wants to unmute themselves to ask Kathy a question, now would be a great time. Well, I'm not seeing anyone responding, so thank you so much, Kathy. I think, you know I learned a lot, and my guess is everyone else did too.
thank you so much for having me.
So that is great. Thank you so much. And then before we transition to our final closing comments, there was a late question that came in for Dr. Paulson. So I'm wondering, Dr. Paulson, if you could unmute yourself, and then I will read the question. And I'm just having to scroll back up to it. Okay. And it's been wonderful that we've had a lot of activity on the chat, so I've got to scroll up a little bit here. So, okay, the question for Dr. Paulson is there a concerted effort by Neurology Center for Excellence to increase awareness to the psychiatric and psychology professionals of Huntington's early stage symptoms? Only after more than a decade of failed attempts by numerous psychiatrists and psychologists to address all of the depression and behavioral issues did a layperson suggest to see neurology. That Huntington's became apparent. So could you address that, Dr. Wilson?
Yeah, can you hear me okay?
I can hear you, yes.
Okay. Yeah, no, it's an excellent question. And it isn't just psychology and psychiatry that needs to learn more about Huntington's disease. You know, from the families, that we need to raise education and awareness for every specialty. When I read that question, I thought to myself, well, then we need to add the principals who arrest the woman who is picking up her children from school to walk them home, who thinks that she's intoxicated. And then we need to arrest or educate the neighbors who say they can't play with your kid because, you know, their dad is an alcoholic. And then, I mean, it just goes on and on and on, doesn't it? Of challenges of having a rare disease. I mean, if this was a more prevalent disease, maybe people wouldn't be more aware of it, but because it is rare, we're going to consistently find people who've never heard of it and who don't know about it. And yes, my whole essence has been, my whole career has been a focus on trying to help people understand that these symptoms and signs that occur in Huntington's disease, they're not anyone's fault. They're part of the brain and the brain's function. And I, as some of you may know, I'm really interested in helping educate people. I have spoken at the American Psychiatric and the American Psychological Association meetings, but it's been a decade probably. So, you know, it might be something we need to revisit, is to say, how can we help other professionals and other just people become more aware of this rare disease. I've been pleased when Hollywood does put it on a TV show, and sometimes they do a pretty good job with that too. But I think the more that we can really be able to be a pioneer with this disease, it's so important because people do not know about it. So I've just seen too many sad instances of people just going to their primary care doc and, you know, they don't know Huntington's, or, you know, like I said, your school teacher doesn't know Huntington's, or your boss doesn't. I mean, people just don't know. So we all need to take responsibility for that. And I certainly will continue to take responsibility for educating people. And I'm open to any thoughts or ideas you have on how we can better educate others on how to learn about this. There's one separate piece I just wanted to mention, and that is that brain abnormalities have many hits against them. One is what Dr. Shannon talked about earlier, that it's really hard to treat any brain abnormality. It isn't as easy as all the other systems because nothing crosses the blood-brain barrier, which is good, right? Because, well, some things cross and some things don't. As she shared with you, cocaine and alcohol seem to do fine, but there's so many things that maybe could be helpful, but it's hard to get any medicines in the brain. So I think there's several steps that we need to work on when we educate one another. And one is just that stigma that somehow brain symptoms and signs are the fault of the person, and they simply are not. And that's not in Huntington's disease or just depression without Huntington's disease. Those symptoms are a brain disorder. And so our judgment in our culture about persons that suffer from these symptoms, and our frustration at being able to fix or treat psychological thinking and psychiatric symptoms is widespread. So I think the more we can do to help kind of let people know the brain is like the heart and the kidney. It has a function to do. And when it breaks down, we have to figure out how to treat it. And that requires a lot of different things in this case. Kind of like, it was interesting to answer the question right after the dental one, because it's hard work. If you live with a chronic brain dysfunction like depression, so you have the neurotransmitters are not balanced, or in Huntington's disease, that gate breaks down. If any of you have heard my talk about the part of the brain that breaks down in Huntington's disease, it's the part that helps us control things. And being an Iowa farm girl, the gate controls the cows, right? You put a fence around your property to control the livestock. Well, the part of the brain that breaks down in Huntington's is a control system. So it lets out emotions, it lets out thoughts, it lets out movements that we don't want. And it also slams tight shut when we don't want it to, and freezes us with our emotions and our thoughts and makes us think we have a memory problem. But in reality, it's the gate, the regulation is gone. And other, short of medicines, which we're not great at treating all these symptoms of the brain, it is really hard work to work on brain compensation and coping. And I really appreciated that you had, what was his name? Peter Thomas?
To Peter. Mhm.
Yeah, that was lovely, because I really think when the brain isn't functioning, it takes that much energy. It's like those days, some days you can just get through your day and you don't think about it. And then those days that you tired, or you have a hangover, or you're hungry, or you're just have a fresh cold, it's like you have to pay attention better, or you are going to blow up at somebody, or you're not going to remember the person's name in the grocery store, or you're not going to be able to recall a memory or to do your job as well. And the brain requires a lot of effort to work on these symptoms. Now, it doesn't mean we can't work on them, but just to show each other some forgiveness and some effort when we're trying to work on these very difficult behavioral symptoms that are due to brain changes, because we all need a little break to help each other work. And I think it goes back to that self-care thing, that it's really hard enough to work on our brain symptoms. So the more forgiveness we can give one another, and the more we can encourage everyone to TLC, give yourself as much tender loving care as you can throughout the day and the week. And I think that's going to be key. And it is key for living your best life, no matter what genes you have.
Thank you. Another late question came in. I don't know if you'll be able to address it or not, but it states, Dr. Dent shared KEGG number information relating to probability of exhibiting Huntington symptoms. Would a lower KEGG number manifest itself in lesser emotional symptoms in older years, or to never exhibit the movement disorder stages prior to their demise if it's a late onset?
The manifestation of the disease does not seem to be straightforward variation with the CAG repeat length. The age of onset does, however, in that the longer the CAG repeat length, the younger the regulation breaks down. Now, how that regulation breaks down, I have really awful slides that you will hate, but I love, that show all these little circuits in the brain, and where the gate breaks down, and how it's different for each person. If the gate breaks down in some people, it's mostly the motor circuit that got, it nipped, or someone else, it might be mostly mood, the amygdala, and someone else, it might be just recall or finding the right word for things. And that's my understanding from the little research we've done on this, is why some people have what people call denial about symptoms. It isn't typically, in my experience, 99% of the time, it isn't psychological denial that you just can't face it. It's organic. The circuit is disruptive. They don't see their movements. They don't see their irritability. They don't see their outbursts. And that is a function of the brain. The brain relies on feedback loops, just like your thermostat relies on feedback loops, right? So when that's disconnected, we know about a third of the people with Huntington's disease have that feedback loop disrupted. So I think it's the same with the rest of the symptoms. Depends on how your loops are disrupted, whether it's emotion, thinking, or motor, or awareness, or all of the above.
Mm-hmm. Okay, and one last question that came in. HD meds have brought about tardive dyskinesia. Any recommendations to deter side effects of those symptoms?
Yeah, I'm not a fan, but that's easy for me to say. That's why you have to talk to Dr. Dent and Dr. Shannon, because the types of meds that are given that are antipsychotics are really big meds that basically sedate the brain. And they do a good job when we have to. Like, there might be times when you have to for safety, or just, lots of reasons might be when you need those big guns, but the newer meds are so much better. The tetrabenazine, deuterbenzine, all of these newer meds are trying not to just sedate. They're really looking at motor circuitry in a much more sophisticated manner. So I always encourage people to get what's called new generation movement disorder meds. Don't use the old generation unless you have to, because they have side effects that are not good. So I really steer away when we can. And always ask yourself the question, am I treating the person with Huntington's disease, or am I treating myself by giving them a med?
Right, my reactions to their issues.
Yeah. And of course it's hard. And you know what? You have every right to need a break. But that's why we need to work as a team to figure out how can we get you a break and not give them a risk of making something worse, either in depression or mood or in a tardive dyskinesia, a new manifested movement disorder. Does that help?
Oh, definitely. Thank you so much. And that's the last of our second generation questions, I guess. I really appreciate you coming back on and helping us out with those. And now we will go back to Vicki, who is our vice president and has some closing remarks.
Yes, and they'll be short because it's been a long day for everyone. And we are just so thankful to have so many smiling faces all day with us. So first, we want to again thank our sponsors, Genentech, Unicure, HDSA, our national chapter. The national organization's been super supportive in trying to help us get education out and provide good material for all of you and connect with all of you. Want to thank all of our presenters. Obviously, we had some really great topics today. Jake Dowell, Dr. Shannon, Dr. Paulson, Dr. Boyd Dent, Dr. Alta-Peter, and then of course, Kathy. Thanks again for joining us. We haven't had a dental topic in a while, so that was a good addition. So thanks to Kathy again. The education committee is Lori Sorgi, Christine Freund, Deb Zwicky, and myself, and we are gonna be sad because we don't usually meet every week, and now we're gonna have a break. So, but we'll be looking forward to getting some information from all of you regarding future topics, what you liked, what you want to hear more about. So I will be sending out a survey like we've done in years past to try to collect some feedback from all of you. So please take a few moments. I promise it'll be short, but we really are looking for what you all are looking for from us so that you can make sure that we're staying on top of trends and new topics. So please take a moment to complete that for us. Obviously, we'll see you next November. We'll have our conference again in early November. It'll be in person, and we're really looking forward to it. So we'll have that date set pretty early so everyone can hopefully plan around it, and we can have a big party all together again after a few years of being virtual. And as always, getting involved. We're always looking for ways to connect. Obviously, if we're joining an education day, we're looking to connect. So other ways you can do that, you can volunteer. We're always looking to grow our board. And that's not a ginormous commitment, and it's a great group of people. So if anybody's even kind of interested in that, there's a lot of opportunity there. We would love to add some new faces going into next year. So you can reach out to me or Deb, our social worker, if you're interested in that. And then of course, our upcoming events. Our next one is in February. We have Reprom, that's in the Madison area. Hoping we can make that our biggest event yet for Sean. I know she puts in so much hard work in that event. And I know I'm looking forward to going this year. Can't wait to have another opportunity to party with my HD family. And then again, just a reminder about the survey. I'll send that out at some point this week. And if there's anything that we can ever do to support and help anyone, please reach out to the board, reach out to Deb, so we can all stay connected and move forward into next year. So that's all I had. Thanks again for joining, and thanks again. I hope you guys have a great rest of your weekend.